Welcome to this live conversation on COVID-19. Today, we're once again joined by Dr. Marcy Drees, ChristianaCare's Chief Infection Prevention Officer, to discuss the current state of COVID and how we can protect ourselves and our loved ones as we go into the summer with Memorial Day weekend right there in front of us. Dr. Drees, thank you so much for being here today.
Oh, thank you for having me again.
And it's a conversation we continue to have. We just spoke a month ago in hopes that numbers were getting better, but that doesn't seem to be the current case. So give us a breakdown of what we're looking at right now with numbers in Delaware and our surrounding counties in Pennsylvania, New Jersey, and Maryland.
Yeah, so I mean, we did see a kind of a low point really since the beginning of the pandemic around kind of the middle to end of March. So for Delaware, for example, our cases were around 40 to 50 per 100,000. That was the low point, and it's come up steadily since then. So this week we're at over 500 per 100,000, so a tenfold increase. Back during the late December, early January, when we were at the height of the Omicron surge, we were at like 2,000 per 100,000. So we're not nearly back to where we were before, nor was it such a sudden increase as we saw in December. But things are definitely continuing to rise steadily. And the other surrounding counties are very similar.
And many people at this point are saying it is the end of May. We are 2.5 years into this. How is this happening?
Yeah, it's really being driven by the Omicron subvariants. So we know that Omicron, the original Omicron that came out in December, was way more contagious than even Delta, and certainly more than any of the earlier original variants. And these Omicron subvariants, which are just kind of sublineages, additional mutations that are happening, are increasingly contagious. So, for example, the original strain of COVID was estimated to infect between, one person would infect between 2 and 3 other people, assuming that they're susceptible. Omicron, I just heard, is probably estimated closer to 10 other people. So it's just so much more contagious. Plus, people's immunity is waning, whether it's from a prior infection or from vaccination. And these subvariants they're evading immunity, meaning you're not as protected from your past infection or from your vaccination as you were for earlier variants. So it's a combination of those two factors, plus the fact that we're behaving differently, right? So everyone's out and about, everything's open, very few people are masking. There's just lots of opportunity for spread to happen.
So let's talk about masking. There's no current Delaware or federal government mask mandates in effect, but the state is encouraging people to mask in public indoor areas in Delaware. So what is your advice for masking?
So given where our community level is right now, which is high, it is recommended that everybody, regardless of your age, your risk factors, your vaccination status, everyone wear masks indoors. Now, I don't think there's much political appetite for reinstituting any of the mask mandates, either in schools or in just in general. I know University of Delaware recently they did change their policy. In healthcare, we certainly have continued masking all along. And we're going to be kind of increasing that a little bit more than what we have been. But yeah, I think on an individual level, even though there's no mandate, certainly I'm putting a mask on every time I go anywhere public. And I'm avoiding indoor restaurants. It's not a good time to be indoors with other people that you don't know.
So it is Memorial Day weekend, which makes it beach season, prom season, wedding season, name your event season. So many people, I think, planned many of these things without thinking COVID would still be a problem. What is your advice to them?
So the nice thing about that is that our weather is better, right? So being outdoors is your friend. It won't protect you if the person, immediately next to you has COVID and is breathing or coughing right on you. But, once you get even just a little bit of distance, that nice sea breeze, like things, disperse pretty quickly, and it's much safer to be outdoors. So to any extent, if you're having a barbecue, keep it outdoors as best you can. And otherwise, I think, we really have to think about masking when you're indoors and when you're around other people for events like weddings, encouraging or requiring all your guests to test before they come. The nice thing is, home tests are now widely available. They're not perfect, but they will pick up some cases that would otherwise go undetected and would spread. But yeah, so it's tough. Like, there will be a lot of opportunities with all these events happening at the end of the year for COVID to spread.
And if someone has one of these big events coming up, would you recommend they kind of lay low this weekend and not put themselves at risk going into one of those big events?
Yeah, no, I think, if you really want to go, you certainly don't want to have other exposures that would then prevent you from being able to go. Like I know, my kid's not old enough, but I have friends whose kids missed their prom because they happened to test positive for COVID the week before. So that was really a drag. So don't expose yourself, ever, but certainly if you have an event coming up, if you're visiting relatives, especially if they're higher risk, everyone should consider testing, before having any of those, or, to protect others. May even consider masking indoors, when you're around people even in your own family or extended family that are higher risk.
So let's stay on testing for a minute. If you're symptomatic, but the at-home test says negative, do you believe it?
So if you're symptomatic, I probably would not believe it, just because there's so much COVID. I mean, there's other things too. There's allergies, there's flu still, believe it or not. There's other cold viruses, but there's so much COVID right now. I kind of feel like everything's kind of COVID until it's proven not to be COVID. And we know that the home tests are not quite as sensitive as a laboratory-based PCR test. So certainly, I think they're a good tool, especially again, if you're asymptomatic and you're trying to, plan around an event. But they're not perfect. Nothing's perfect. But if you're symptomatic, I definitely would recommend getting a laboratory-based test if you're home tested.
And a submitted question we got right before this live is a similar question, but kind of on the back end. If you were COVID positive and it's been 10 days, you're starting to feel better, do you do an at-home test before going back into the world?
So there's no official requirement to do that. So if you're COVID positive, they recommend that you absolutely isolate for 5 days. And then after 5 days, assuming that you don't have to be asymptomatic, but you're afebrile, no fever for at least 24 hours, your symptoms are improving, then you can kind of start to go out into the world with strict masking and not going into places where you can't be masked. And there's no specific testing requirement around that. We have been testing our healthcare workers at 5 days, and I would say 3/4 of them are still positive at 5 days. And some of them are testing themselves again later than that, and they're still positive. It's a little bit, the farther out you get, it's a little bit hard to know exactly what that means. It probably means you're still contagious because they're detecting, that those antigen tests are better than the PCR tests for determining kind of active virus. If you're immune compromised, we do recommend that you test kind of before you end your isolation. But yeah, I think, it can be a helpful tool, but there's not a specific requirement to test before you end your isolation.
And if you are testing COVID positive and you're certainly not feeling great, at what point do you call your doctor and discuss treatment options?
So you should really call your doctor right away, as soon as you know you have COVID, or even if you think you probably have COVID. Because there are treatments available, and some of them are very time limited. So the main one is Paxlovid, but there's another oral one that has a little bit less utility. But and both of those have to be given within 5 days from onset of symptoms. And so when you think about, like, it might take a day or two to get a test and get tested, you kind of start to lose time if you then wait after that. But really, anybody who's at any higher risk of severe disease, so that could be older age, it could be underlying conditions, who also has symptoms, is eligible for these medications, or the monoclonal antibody, which is given as an infusion. So those are available out in the community. And so really it behooves you to kind of even before you have COVID, kind of have a plan. Hopefully you have a doctor, how to get a hold of that person. You have home tests, you have a plan for what you would do should you be symptomatic. And those drugs and the monoclonal antibody do help keep people out of the hospital, which is the main point of using them.
And speaking of that plan, say you got COVID, your spouse doesn't have it yet. Recommendations for how to kind of make that work?
So it really, the ideal recommendation is you separate. So that might be sleeping in separate bedrooms, if that's available to you. Even masking indoors when you're in the same room as anyone else in your family who's not COVID positive. Again, it's all the things that we kind of know how to do. the more that everyone's vaccinated. We don't give vaccines kind of as post-exposure prophylaxis, but getting everyone up to date is important as well.
And we'll get into vaccines in 1 minute, but we have a follow-up submitted question. If you got this current variant of COVID a few weeks ago, can you get it again?
So that's one of the issues with the Omicron subvariant. So I think, it's changing kind of on almost every couple of weeks of which subvariant is the most dominant one. We still think that if you have COVID, you're unlikely to get it for about 3 months. So you can actually wait. Like if you're due for your booster, but then you got COVID, you can wait up to 3 months to get that booster. You don't have to wait, but you can. Just because we think that your immune system was probably boosted by that infection that you just had. But we are seeing people who had Omicron, back in December, January, February, now getting one of the Omicron subvariants. So absolutely, this is that's one reason why we're seeing an uptick, is because people are able to get this more than once because their immunity wanes, whether it's from natural infection or from vaccination.
So let's move into vaccines. The CDC is now expanding eligibility of the vaccine booster doses to everyone 5 years of age and older, saying children between 5 and 11 should receive the booster 5 months after their initial Pfizer vaccine series. Some parents at this point are saying it's the end of the school year. Do we wait until September? Do they really need it? What is your advice on that?
Yeah, there was a big discussion at the ACIP as whether do we recommend it as everyone in that age group should get it, or everyone in that age group may get it. And ultimately it was decided that everyone should get it. And part of that was just to streamline it with all the other recommendations. If some are may and some are should, it just gets really confusing. But there is a significant burden of illness in this age group. So almost 5 million kids, 5 to 11, have had COVID. And while we know that the overall risk of severe disease and death in that age group is low, it's not zero. And it's actually higher than some of the other diseases that we routinely vaccinate kids for, like flu and hepatitis A and meningitis. Before those vaccines were available, we didn't see as many cases of those diseases as we do of COVID now. So the vaccine is extremely low risk. The biggest issue, honestly, is that so many kids are not vaccinated at all, right? So something like 87 or 90% of hospitalized kids are completely unvaccinated. And many of them, a third of them don't have risk factors. So it's not like, oh, my kid's healthy, they don't need it. Really, all kids should be vaccinated, should be considered a routine vaccine, just like everything else we do, to prevent not only them getting sick in the hospital, hopefully preventing long COVID symptoms, which are common, multi-system inflammatory syndrome, which happens after you have COVID, even after a mild or asymptomatic. There's lots of things that these vaccines can help to prevent. My kids, fully vaccinated and boosted, so I'm speaking not just as a doctor, but as a mother as well.
Absolutely. And what is the current status of the vaccine for those 5 and younger?
So finally, there's good news on the horizon. So the Pfizer vaccine had been delayed because they initially saw that 2 doses was probably insufficient. So they're getting ready they've submitted their 3-dose data to FDA. FDA is going to review that middle of June. And so I would expect to have a decision very shortly after that. That's for Pfizer under 5. And then at the same time, they're actually going to review the Moderna under 18 data as well. So both vaccines, if authorized, will be available for 6 months and above. And so again, also seeing, a significant burden of illness in that group. And really right now, like the only thing that parents can do to protect those children is isolate them, which is not a sustainable plan, moving forward. So it'll be nice to have an option for those as well.
Right, absolutely. And the CDC is also strengthening its recommendation for the second booster, recommending it for those 12 and older who are immunocompromised and those 50 and older. So what is your message about the importance of that and why that second booster is important?
So the second booster was first kind of optional, I think back in March or April, I can't remember, for those groups that you mentioned. I think anticipating that what we were seeing was going to happen, that these new subvariants would start to emerge, we'd start to see cases And I think they just made it a stronger recommendation because of that. That's exactly what we've seen is people are, or the cases have come up so dramatically. And many people in that age group, they were boosted back in the fall. So it's been not only 4 months, it's been 8 months or 10 months, and their immunity really has waned. Why that specific age group? It's really focused on preventing severe disease, hospitalization, and death, which we know people over 50 and immunocompromised people are at risk for. If you're younger than 50 and you're otherwise healthy and you've gotten 2 doses plus a booster, you're probably pretty well protected. So the additional benefit of getting that second booster is probably, relatively small. And we don't know yet what's going to happen in the fall. And so I think, I don't think people should delay, get it. If they're recommended to get it now, they should just get it and we don't know what's going to happen in the fall. So we shouldn't wait thinking that, oh, I'll just get it in the fall. Because, there's so many things, COVID has always kind of thrown left hooks at us, and we never can really predict what's going to happen. So I think we just move forward with what we know right now. And that is that, people need that second booster if it's been more than 4 months since their last one. I mean, that's not going to be a sustainable plan forever. We can't just continue to do boosters every 4 or 6 months, but I think in the near term, it makes sense to do that.
We do have a submitted question from a viewer asking, once we've recovered from COVID, how deeply should we clean our home?
So the nice thing is, COVID doesn't survive. I should say COVID has been shown kind of experimentally to survive on surfaces for 2 to 3 days, perhaps. Depends on the type of surface and the humidity and the temperature and all that. But we really haven't seen a lot of transmission specifically from items. Someone touched a pen and someone else who was never in the same room as that person got COVID. Like, we haven't been able to detect very much of that. It really seems like it's almost all kind of, close proximity respiratory spread. And so I don't think I'd go crazy, like bleaching your entire house if you've had COVID. But I think, common sense, cleaning high touch surfaces with an improved disinfectant, doorknobs, telephones, cell phones, anything that people might share. Certainly, I think it makes sense to clean that.
And our next submitted question, if you are vaccinated, had 1 booster, but contracted COVID, should you get a second booster?
So that was another fairly recent change. They used to say that, if you've had COVID, you wait until you're better and you no longer need isolation. But then if you're due for a vaccine, go ahead and get it. And now they're saying, you might actually want to wait up to 3 months because that you did get a little bit of a boost, most likely from that infection that you just had. So if you were about to get your second booster and you got COVID instead, you probably would wait. There may be some situations where you may want to still get it earlier, like if you're about to travel or if you're immune compromised or, otherwise high risk, so you can get it earlier. But we probably don't necessarily need to it right away.
And let's talk about long COVID. Some people got COVID months, almost a year ago, and are still seeing some of those symptoms, still not feeling like themselves. How does long COVID work?
So I think how we don't really fully understand yet. So, and even, that was one area that we really didn't have a lot of data on. We kind of had a lot of kind of anecdotal reports, and we know that it was happening, but how frequently it was happening was not clear. But there was a paper published earlier this month that looked at a cohort of hospitalized patients with COVID and without COVID, and then followed them out for a period of time to see what other things happened to them. And they basically found that for almost every disease that they looked at, people who had COVID had symptoms. So it was everything from like shortness of breath and fatigue and to mental health, sleep problems, depression. It ran the whole gamut, like blood clots. And so they found that, it's actually of adults like under 65, I think it was 1 in 5 had some kind of long COVID type symptom. And 1 in 4 adults over 65. So it's quite common that people would have these lingering symptoms. So again, we don't know definitively that getting vaccinated, if you get vaccinated and then you still get COVID, whether that truly, we think it probably helps to reduce the chance of long COVID as well. But certainly if it helps prevent infections, you can't get long COVID if you don't get COVID.
And what is your message to those people saying it's been 2.5 years and I haven't gotten it, so obviously I'm just the best?
Yeah, well, you might be. There probably are, there are people that, despite having a lot of risk based on, not being vaccinated, whatever their job is or whatever activities, they don't get it. And maybe that's because they did get it and were asymptomatic and they never, never knew that they had it. And I think there's probably a lot of those people out there. They've done studies looking at blood, like leftover blood from blood donations, to see how many people just had antibodies, not to the vaccine, but to COVID illness. And it was really high, like 75% of younger people, I think kids, and then it kind of went down from there, kind of along with the lines with, the over 65s were the lowest, but they're the most likely to be vaccinated. So it was, and this was all after Omicron. So I think kind of Omicron kind of blasted through the entire population. And so a lot of people have evidence of infection, whether or not they know they had it. Now, the fact that they have those antibodies that are detectable does not mean that they're protected from getting it again. So that's the downside. But it does show that it's kind of affected a lot of the population. So I don't think, just because you haven't had it to date doesn't mean that you can't get it. Like I actually have a number of colleagues that, just recently had it and they'd made it 2.5 years without getting it. And now, again, it's ever more contagious and the whole society is behaving differently than it has in the last 2 years. So I think risks are definitely increased. And so it's not a guarantee that you, just because you haven't had it yet, that you can't get it.
And Dr. Drees, I hesitate to ask this question because you and I have talked so many times since the start of this in March of 2020, but people are asking, where do you see this going?
So I wish my crystal ball was working. It doesn't, however, and I think what everyone's kind of hoping will happen is that this virus will continue to mutate. And as it mutates, it gets milder and milder and milder, so that it becomes more like the typical human coronaviruses that are really just common cold and don't cause severe disease. I think that's wishful thinking to some extent. I think it's probably more likely that it will end up being something that looks a little bit like flu, like it has some predictable seasonality to it, which right now it doesn't have, because obviously it's surging in the summertime, which we don't see with flu. But flu still kills tens of thousands of Americans every year who are vulnerable for it. So and that's unfortunate. And I see coronavirus probably going more in that direction than becoming a completely benign disease. It's very clear it's not going away. And so we're going to have to figure out how to live with it. And what does that mean in terms of vaccination? Is it an annual booster for at least the next couple years? Is it more frequent than that? It's not sustainable to do boosters every 4 to 6 months, like I said before. So we're going to have to figure out, hopefully we can get to some sort of booster that provides a little bit longer term immunity so that we won't have to keep boosting quite as often.
So you shared so much important information today. Before I let you go, what is your key takeaway that viewers need to understand?
I think that my key takeaway is that, I know people all want this to be done and be over and move on. And the virus, unfortunately, doesn't care what you think. It's just going to keep trying to spread and spread and spread. And so, we have to try to hang in there. And, we have so many more tools in the toolbox than we did in March of 2020, right? So we don't have to go back to shutting down society and destroying the economy and all that other thing, but we still need to be smart about it. And do the things that we can do to prevent risk in ourselves and in those that we love.
Dr. Drees, thank you so much for your time. And if you're watching and have more questions for Dr. Drees, please continue to put them in the comments under this video, and we'll be able to chat with you in the comment section. Please also keep an eye on ChristianaCare.org, this Facebook page, YouTube, Twitter, Instagram. We've been with you for 2.5 years, and we will continue to be with you as we ride into this next wave of COVID or whatever is to come. Thank you all so much and have a great afternoon.